Hello friends. I have seen many students finding it difficult to understand the pterygopalatine ganglion and its branches. So once you understand it correctly, then to remember these branches is very simple. Now let us look at this figure here. On to the left, we can see the lateral view of the skull. The zygomatic bone is cut here. So, and the mandible is of course removed. You can see the maxilla with the upper molar, upper teeth are arranged here. And a soft tissue shadow of the nose is also seen. Now, let us, so once the zygomatic bone is cut, we can see the pterygomaxillary fossa very clearly. So again, let us see the description of the pterygomaxillary fossa. The maxilla, the body of the maxilla can be appreciated in the front. See, like this is the body of the maxilla in the front. Behind, you can see the lateral pterygoid plate of the sphenoid bone. So we can call it pterygomaxilla. So the fossa is called pterygomaxillary fossa. Whatever is in between is a fossa, which is floored by the palatine bone or the vertical plate of the palatine bone. So we call it as the pterygopalatine-maxillary fossa. Now, so for the same reason, so if you look at the picture on the right, it's an enlarged picture, you can see the pterygopalatine ganglion. So what exactly is pterygopalatine ganglion is what we have to understand first. Pterygopalatine ganglion is nothing but a parasympathetic ganglion which carries secretomotor fibers. That means it carries the postganglionic fibers carries secretomotor supply to the glands like the lacrimal gland, the mucosal glands in the orbit, the oral cavity, pharynx, etc. Now, so that means whichever postganglionic fibers arising from the pterygopalatine ganglion has to go to all these structures, namely the lacrimal gland, the mucosa lining the orbit, the oral cavity, pharynx, nose, etc. So that itself will give you a clue where will this branches or the pterygopalatine postganglionic fibers of the pterygopalatine ganglion will go. You are right. So let us keep this idea in mind and let us visualize or let us think about where these branches will go. Let us go to the picture onto the left. Now I hope you can see my cursor. You can see the gland, the pterygopalatine ganglia here. Now, see, look at this. One branch. Okay, let's do like this. Let's do a very simple exercise here. Take the pointer and okay, let's take this. The pointer option you can take here and let us see. Okay, let's take a pen and let's try to draw an axis here. So let's first draw a vertical axis. Then let's draw an anterior posterior axis. The third axis I cannot draw because that is medial to lateral axis. So imagine these three axes which will show 6 directions, correct? That one direction up and down, one direction forwards and backwards, and the third direction medial and lateral, which is not drawn here. So let us see the first direction forwards. Can you see if a branch moves forward, it is going to reach the orbit. So you are right. It travels through the floor of the orbit and it goes all the way around. It pierces the maxilla. Okay, because maxilla is in front and it forms the floor of the orbit. So it pierces the maxilla and jumps out through the infraorbital foramen. So let's understand for the time being, the forward branch will travel through the floor of the orbit and supply the periosteum mucosa of the orbit. Okay. Now, imagine if it has to go up. So here above is the temporal bone. Here the temporal bone. If a branch going up can be named as temporal. So it's actually coming from a zygomatic branch. So we can call the branch as a zygomatic temporal, which will go to the lacrimal gland, or which will connect to the lacrimal nerve and eventually enter the lacrimal gland. So here is the lacrimal gland. You can see The branch which is going up is zygomatica temporal, which is going to end at the lacrimal gland and again cause secretions. As I told you, it is a secretomotor fiber. Next branch is what goes backwards. So what is backward here? You have the nasopharynx, correct? So backward behind is the nasopharynx. The branch which goes to the the pharynx can be called as a pharyngeal branch. As you can see okay, if you go to the right, so you can see the pharyngeal nerve here. Can you see it going backwards? Okay. Through the palatovaginal canal, it goes backwards. So the branch which goes backward is to the pharynx, so we can call it as a pharyngeal branch. What is the branch going downwards? Here, can you see the branch going downwards is obviously going to reach the palate. So palate is nothing but the roof of the oral cavity. So now the branch which goes down will reach the roof of the oral cavity, travels forwards as the greater palatine nerve, and travel backwards as the lesser palatine nerve. Okay, so that is what you have to understand. The branch which goes down will supplies the roof of the oral cavity where also there are mucous glands. It will cause secretions in the mucous gland in the oral cavity. Now remaining are two branches which I cannot show it in this picture, but you can very well make out that is a medial and lateral branch. Let us look at the medial branch. So what is the area medial to this is the nose, the nasal cavity. So now you look at, so you can see there's a foramen here known as a sphenopalatine foramen. That's a foramen between the sphenoid bone and the palate. So this is sphenopalatine foramen into which the nasal nerve goes. So nasal nerve goes medially. So there are a number of nerves which goes to the nose. I'm not going to the details of that, but understand that the nerves which are going to enter the nasal cavity or the nasal cavity are going to enter through the sphenopalatine foramen, and it will travel medially, which I cannot draw it here, but you can imagine like this. I'm just drawing up like this. What about the lateral branch? So here you can see the lateral branch. So now, as you know, maxillary nerve obviously have to take care of the sensory supply of the maxilla and the teeth which is located in the maxilla. So that the first branch for this, so that's called a dental plexus. So the first branch is here. That is a posterior superior alveolar nerve. So that we can take it as a lateral branch maybe. Okay, and you can see other branches, middle, anterior, all arising from the infraorbital nerve later on. Let's not go into the details of that right now, but let us understand these 6 areas or 6 directions in which the Pterygopalatine ganglion branches moves. That is, anteriorly goes forms along the floor of the orbit and jumps out as the infraorbital nerve in the maxilla, goes up as a zygomatic temporal branch, and finally supplies a lacrimal gland. Towards medially, it enters the nasal cavity. Behind, it goes to the pharynx as a pharyngeal nerve. Below, it goes to the roof of the oral cavity as the greater and lesser palatine nerve. So this is what you have to understand. Now imagine if this gland is irritated, what all things will happen? One, your lacrimal gland will activate. You will cry. You will start lacrimating, or your tear will come from the lacrimal gland. And imagine all the mucosas which are related with these branches are also going to get secrete. You will have secretions in your mouth, secretions in your pharynx, secretions in your nose. So think like this. Pterygopalatine ganglion, if it is irritated, it is going to create immense secretions in your orbital cavity by the lacrimal gland, nasal cavity, oral cavity, nasopharynx, etc. So this is the structural or the anatomical definition of hay fever, which causes allergic inflammatory reaction in your pterygopalatine ganglion and causes secretions or excessive swelling and secretions in your mucosa. Thank you. Please subscribe the channel, support, subscribe and share the channel for further videos. Thank you.